Hey y'all, I just wanted to make a really quick update because I had my top surgery pre-op appointment today, this morning at Dr. Agarwal's office. So for context, for those of you who don't know, I will be having double incision top surgery on June 4th with Dr. Cori Agarwal in Salt Lake City. And I wanted to do a quick update because today's pre-op appointment just answered some of my questions that I had. And I also am trying to document all of this because, especially right now, with everything going on with social distancing and people being really cautious being around other people, it was just really interesting to have an in-person doctor's appointment like this. So I wanted to go over some of the things that hospitals are doing as safety precautions. First off, it's interesting. As a sci-fi writer, I'm always kind of reminded of like dystopian scenarios when I see stuff like this. But the hospital had set up all of these checkpoints where you couldn't even like go and park before you had to talk to like this checkpoint of masked people who were asking you whether you were showing any flu-like symptoms and how your health was before they even would let you in. And then they also monitor that. They had another checkpoint and kind of like, hey, this is where you enter and this is where you exit, kind of barricades set up at the entrance. So they check you there. They very much direct you. There's a check-in counter at the main entrance where they will take your temperature with a touchless thing. So they will make sure that no one who's sick is entering the hospital, which is again kind of like it's that mix between it's wild but it's also reassuring, especially since I'm super concerned about getting sick prior to surgery. My immune system already is borderline compromised. I have a blood clotting disorder, so for that I have to take medication, anticoagulants that are historically not great for my immune system. So I'm from now for the next 15 days before surgery basically self-quarantining. But one of the things that they will also have me do prior to surgery, 2 to 3 days before surgery, is go in and get tested for COVID-19, just to make sure that I'm healthy and that they safely can perform the surgery. And again, like that's just like another step that we have to take right now, which is standard procedure in all hospitals in Utah. And then the day of surgery, I won't be able to have my wife with me, so she will drive me there. She will drop me off. She can't come in with me. And then I like check in, I get into surgery, and that's kind of what they went over today as well, that I will see Dr. Agarwal, her PA that I talked to today, who was awesome and answering all of my questions. They basically will like draw all the marks that they need to see like where they need to make incisions and what is happening. And then I will apparently be walking into the OR, which was interesting, and I was grateful that they told me about that. So because they mentioned that sometimes freaks people out, but it's just like because of how you have to move like from I think the gurney into like the operating bed, whatever. So that's going to be really interesting. I'm honestly like one of my main concerns was, and this appointment really was all about answering questions. Like they didn't need any before pictures from me because we had already taken those during my consultation in December, and I already knew that yes, I would be getting a double incision with 3 nipple grafts. I already know that like roughly what my scars would look like and where they would go. So a lot of those questions were already answered, which was nice, and also made this like a pretty quick appointment. Honestly, it was just basically going over the procedures, answering some of my questions, which mainly related to my medication that I'm currently on. As someone with risk factors, as someone with a blood clotting disease, I do take blood thinners every day. That's something I have to do for my whole life. And they will have me go off of my medication 2 days before surgery and then go back on about 24 hours up to 2 days after surgery. But other than that, I am going to be staying on all of my other medications. My testosterone will be just fine. My shot is actually due the morning of surgery, so I will do that before heading out and going to the clinic. They also went over and said that they would be calling my wife once I was done to talk to her about how the surgery went and also what my post op instructions are. So they will kind of go over taking care of my drains and things like that with her on the phone before she comes and picks me up, which again is kind of like this wild situation. Normally they would show that in the hospital, but it sounded like from what she told me that they have pretty good experiences so far with having that procedure in place with everything that's going on, making sure that everyone is as safe as possible. So yeah, all of that is kind of wild. I had a whole list of questions that I asked them. I literally am keeping a journal that has all of my like pre-surgery prep, and then I want to do a lot of like journaling and reflection just because this is a major like step in my life, and I want to make sure that I am taking the time to really fully reflect on that. So I was able to ask all of these questions. It was really helpful to kind of get a step-by-step overview of how surgery was going to happen, and that they will provide like all of the post-surgery supplies, how the post-surgery binder is going to work. So it's basically going to be a compression vest, and going from there, yeah, just making sure that everything is done as safely as possible. For me personally, since this is my very first surgery, that's kind of where most of my anxiety lies, honestly, is that I've never been under. So we talked a lot about like what that's like and what her experience has been ever since she's been doing this, and risk factors associated like that. We're mostly worried about hematomas, like again with my bleeding risk. That's something that I will have to really watch, and I'm kind of like in that boat where I have to watch for extra bleeding, but also be careful of getting any blood clots. So I am definitely encouraged to move around post surgery as much as I can. Obviously, just getting up and walking a little bit every hour or so is probably going to be the max I can do. But yeah, I'm feeling pretty good about that, or as good as I can. And then we're going to kind of see as surgery is approaching. Like I have 15 days, or more like 14 days from today. And I may or may not opt for some medication to handle anxiety, because yay, chronic anxiety and depression means my brain is kind of working in overdrive as I'm getting ready for this. So that's something I might opt for. But yeah, that's basically what I'm doing to prepare. I'm feeling really good about the University of Utah and the entire team. Like I feel like they really are not cutting any corners and being safe during these times and making sure everyone feels okay about everything. Like it was really interesting to observe that, and just kind of see how that goes. Like being on my own during surgery isn't ideal for me, but at the same time I'm kind of that person who um, is used to handling these things by themselves. So I don't know. I think it's going to go okay, and I'll definitely be like texting my wife as much as possible, and documenting things as much as possible. So that's going to happen. So next step for me is self-isolating, and then doing my COVID-19 testing on the 1st of June, just so that they have enough lead time to be ready to know like where I'm at before surgery. But yeah, that's just a quick update. Let me know if you have any questions about any of this. I definitely will be making more top surgery related videos documenting all of this. A lot of it will probably be vlog style just because I'm trying to capture as much of this as possible. So anyway, thank you for watching. Again, please subscribe to this channel if you are here for more gender and transition related content, and check out my Facebook, Instagram, and Twitter at AlexHarrowSFF. Thank you and peace out.